historically, when America catches a cold, black America catches pneumonia. And we are seeing just that in Chicago. It's 30% African American, but African Americans account for 70% of the coronavirus deaths. The list goes on. Share with us what is going on.
Well, actually, there's now a spotlight on these injustices, the systemic racism, the big, huge gaps that we have in our social safety net. So, just like you said, in Louisiana, we got, 70% of the folks who are dying are African American, 40% of the folks in the state of Michigan are African American. As you sort of shared with folks, you're twice as likely to die in New York City. New numbers came out today. Wow. If you're African American. In Washington, D.C., 56%, I think at the last count a couple of hours ago, were African Americans. And the first death in West Virginia, which actually came from my family, was an African American. So, we've got a number of things that historically have put our communities of color and especially African Americans at a disadvantage. Everything from being in medically underserved areas, where literally we have these physician deserts. We have 20 million people in our country right now who are living in a physician desert, meaning that, there just are not doctors and clinicians around to be able to help them. And then you overlay that with the fact that in medically underserved areas, and we're about to see an explosion happen in rural communities and other places, you literally have had hospitals and clinics shutting down at record numbers over the last few years. And, unfortunately, the current administration, who had the opportunity to actually address that particular aspect through resources that could have went to HHS and could have went to CDC and some of the other departments and agencies, they decided not to, which is crazy considering that we were supposed to be in a time economically where our country was stronger than any other time before. So for you not to make those investments just doesn't make sense.